Good morning, and thank you for inviting Spain to be an example of a late implementation or late authorization of PrEP in Europe. I'll talk about the epidemiology of HIV in Spain to put PrEP needs in context, try to summarize the history of PrEP authorization in Spain, addressing political actions and administrative actions. And although it is very boring, I think it's important that we place public health and policy governance in Spain, because this will help us to understand why things have been the way they have. This is the picture of HIV epidemiology in Spain. We have an important epidemic, as you can see. The estimates from 2017 show that from 140 to 170 people were living with HIV in Spain, and close to 4,000 new HIV diagnoses are made every year. It's close to 4,000 because this figure here does not correct for reporting delay. Doesn't correct for reporting delay. The epidemic, as in many other European countries, is heavily concentrated in men. You see 85% of the cases are men, and it's largely in men who have sex with men that account for over half of the new HIV infections, but probably among the unknown category, many of them are also MSM. These are the trends on the new HIV diagnosis over time. And the upper line in pink or red, we can see stable trends. That's men who have sex with men, the rates in men who have sex with men. And you see a stable trend from 2009 to 2015, and a drop that has taken place in the last 2 years. And this is similar to what we're seeing in other countries, and is related to a number of aspects, and probably through informal PrEP use as well that is not being recorded. And the other groups have been declining for a long, long time over time. So it's largely a concentrated epidemic in men who have sex with men. And just to show here that the proportion of late HIV diagnosis in Spain, like in other European countries, is very high, about half of the new HIV reports, and the lowest is in MSM because they test more often. So this is the story till 2016 that you know very well. So what happened in Spain after the EMA authorized the use of emtricitabine and tenofovir for prophylaxis of HIV? Well, the Spanish agency, the Spanish equivalent to EMA, la Agencia Española de Protección de Datos, also approved PrEP. So PrEP has been approved in Spain, authorized in Spain, since 2016. But no decision regarding public funding, that's the reimbursement, was taken until last week. So for 3 years, there was not a yes or a no to this very important decision that had to do with how to move next for PrEP implementation. Now, in Spain, antiretrovirals can be only delivered in hospital pharmacies. Therefore, the only way to access PrEP in 2016, 17, and 18, and well now, is through a private pharmacy in a private hospital. That's the only legal form to access PrEP. And that's very expensive. It was very, very expensive before generics were available. So it's a huge barrier. So it was authorized, but it wasn't accessible. So what should have followed is that after, how do I go back? Okay, so what should have followed is that after the Spanish agency, I'm not very efficient with this, all right. So it's that after the Spanish equivalent to EMA authorized PrEP, it should have moved to another sector of the Ministry of Health to evaluate funding. That's by default what happens with all drugs, but it didn't happen for PrEP. So understandably, and I think it was a good decision, because PrEP had such important public health implications, it was decided to ask the Commission of Public Health in Spain. That is a commission that sits in the Ministry of Health with the 17 regional representatives of Spain that Michael was referring to before, that take joint decisions about public health in Spain. So this commission requested a report from the ethics body of Spain, the Ethics Committee, regarding the suitability or the appropriateness of funding PrEP publicly. And this report came very fast. This report from the Bioethics Committee in Spain, and was favorable. It said, yes, it's okay to fund PrEP publicly. Of course, they could use condoms, yes. Like people who are overweight could also reduce the weight through exercise and other eating habits, but we still give antihypertensive drugs to people who could do things for the health through behavioral change. Of course, there are populations that take high risk in their sexual lives, but we live in societies that encourage people to take risk, travel abroad, you may get malaria, and still the public health system will fund your cost in a public hospital. So this report was amazing in how it put PrEP funding, public funding in context. The same year, the clinical society GESIDA very rapidly produced guidelines for PrEP implementation in Spain, so things could be forwarded. But what happened was that someone then said, all right, we're not ready yet, we need a feasibility study. And everything got stopped. And this is a lesson. I was very critical about this decision. I was not at the Ministry of Health. It's not elegant to criticize what your predecessors have done, because it's much more complex than to pinpoint just one person. But this need for the feasibility study somehow delayed any further decision making. And it was comfortable for many, many people, not only my predecessors at the Ministry of Health, whom I have publicly challenged, many people were accountable for this joint decision. So, well, this went on and took some time, and 2017 happened. So this implementation study took place only in 3 places in Spain, one of them in Barcelona checkpoint. Michael has shown you, well, their amazing work and their leadership in the PrEP field, among many other things. And Barcelona checkpoint was here, together with another STI clinic, because this feasibility study was trying to look at different models for PrEP implementation, a community center like Barcelona checkpoint, an STI clinic like Drasanas in Barcelona, and 2 hospital HIV STI clinics in San Sebastián and Valencia. And this map, you may have seen it a couple of years ago, and the whole of Spain was in implementation green. So it gave the false idea that we were not that red. We were greener than we were. So we asked Timor only last year, Timor, can we make this picture a bit more realistic and show that most of the territory is red? And it was important to highlight our redness, because in commissions, people don't like to see your maps in red. So it was an important step that we took when we went to the Ministry of Health just over a year ago now. It seems a lot longer, but it's only a year ago, and Timor was very supportive of this change. Well, in the meanwhile, people were taking PrEP, as Michael has shown. People were taking PrEP in part of the studies, but also were taking PrEP on their own in various sites. And I want to pay tribute here again to all these PrEP heroes like Ferran and Michael, but Alejandro from Seville PrEP Point is around here, Alejandro, and colleagues from Sandoval. Oh, I'm not getting this right, really. Okay, colleagues from the STI clinic in Sandoval, that is an STI clinic in gay area in the center of Madrid, also supporting people who were buying PrEP largely online, which is an illegal practice in Spain, because buying it in private hospitals was really just too expensive. So in the first semester of last year, 2018, while the feasibility study was going on, the Ministry of Health issued these guidelines on PrEP implementation, very similar to what the Clinical AIDS Society had issued 2 years before, right? So it just highlighted the way we should do. So the last part of the half year after the government of Spain, following this motion of confidence, changed government, and there was a new team in the Ministry of Health, and I was invited to join this new team at the National Plan on AIDS. And of course, PrEP was in our agenda. It was a claim by many sectors, by too many people that you know too well for me to remind you all. So we really wanted to give a renewed impulse, but it had to be within the governance bodies of the Ministry of Health, because there was the key. We had to open that door with a key within the Ministry of Health. And there were these governing bodies that I will be referring afterwards. Is the National Committee of Public Health, this very important committee that is chaired by the Director of Public Health of Spain, who is very supportive of PrEP. And she's been a leader in supporting all the actions that we have done at the National Plan on AIDS. And she could be supportive because the Minister of Health was supportive and because there was political commitment. And honestly, after these 12 months, I cannot say enough that you may have all the scientific evidence and all your willingness is very important, but without political support and political will, things do not move. So we started working with these governance bodies. This is the Minister of Health in Spain. Opposite the Prado Museum is a very beautiful site. Well, not the building, but the area is very beautiful. And this is the General Director of Public Health, where the National Plan on AIDS is. And we have to work in close line with the General Director of Pharmacy, because tenofovir and emtricitabine is a medicine. So we need to make sure that these two people talk to each other and work together. And we have these committees, all right? The National Committee of Public Health, which I've referred to, and there are other technical committees that respond to this Public Health Committee. So we had to get everybody on board and everybody talk to each other and everybody to have the same narrative. And this is what we were building over the last year with, of course, the National Committee of HIV NGOs, which is a very active committee. And of course, this active committee was voicing all the work that was going on at community level and all the pressure and all the work that all these NGOs were doing also at the regional level, because the people that we met with, the people we met with here obviously were very sensitive to what the NGOs were telling them locally. So lots of interaction. A very, very, very important step what happened in November 2018. It looks ages ago, but it was only a few months ago. There was this proposition not of law in the Health Commission of the Spanish Parliament. This proposition not of law was approved unanimously by all political parties. So this meant that every political party in the Spanish Parliament was in support of PrEP. Of course, it's a proposition not of law. It didn't have implications. It was sort of like a declaration of interest. But this is something that we used heavily to push the agenda. And we went back to this Public Health Committee and said, your political superiors are expressing in the Parliament support for PrEP. We decided to use all governance tools we had available, and we reactivated the National Commission of the AIDS Plan. That had not met since 2018 because the previous government had closed that commission. But by law, we looked and we had all this paperwork that supported that we were entitled to renovate the commission. So we did. And on the 5th of February, we held this important meeting where civil society meets at the same level of discussion with public health officials. And you cannot see very much, but this is our Minister of Health and this is our Vice Minister of Health who came to welcome this commission for the first time, that had met for the first time in all these years. And within our agenda, it was PrEP authorization in Spain. And we had the support of the Minister of Health pushing this agenda forward. So this summer, we've continued working with our colleagues from the Pharmacy Directorate, and we've estimated the number of potential PrEP users in Spain, divided by all autonomous regions and the 2 autonomous cities. So people could have an idea of the kind of numbers and the budget impact analysis this would have. So only, and at the same time, and it was very, very important, during this summer, the Minister of Health and the General Director of Public Health have been supporting the National Plan on AIDS in condom promotion campaigns. We've had this picture in the door of the Minister of Health for 3 months. Condoms were not visible in Spain for 10 years. So we are also promoting condoms for the people who want to use condoms. And this is something that's also been very, very useful in our general public health discourse. And there's been this condom promotion in Gay Pride and also in various regions. And the Minister of Health has been promoting condoms herself. So this is my last slide, because all this work led to this last sentence, which is what took place on the 30th of September, just less than 2 weeks ago, that the Interministerial Commission of Prices, that again is a collegiated body with representatives of the autonomous communities, the Minister of Finance, the Minister of Economy, they analyzed this budget impact analysis of having PrEP, invite various pharma companies, well, it's open to every pharma companies because generics are available. Things were a lot easier because in terms of budget, things are a lot cheaper, and that's excellent news that we've got generic drugs for PrEP. And this helped us a lot to make a very strong economic case. So this approval is now being signed, it's been approved, and it's been announced by the Minister of Health. And this will allow the autonomous communities, as Michael was saying, to now implement the PrEP programs at regional level. of course, this is the beginning of a new phase. Some places like Catalonia are ready for that. I think Madrid, even if probably not as advanced as Barcelona largely, will also catch up quickly because there's a lot of informal network of things going on. In Seville, you've done a lot of work, but Andalucía is very big, but big challenge, but we've got key players there. So this is for probably next year, but it's good news, and there's many people to thank, but I don't have time, and many of the people I've thanked have already done are here on the floor. So thank you very much.